Hello everyone, and welcome to today's detailed tutorial on local anesthetic agents. In the next few minutes, we'll dive deep into the types of local anesthetics, their uses, and how to manage potential toxicity, with insights and practical tips for clinical practice. Local anesthetic agents are essential in both surgical and diagnostic procedures, providing pain relief and allowing specific areas of the body to be treated without general anesthesia. These agents work by blocking nerve conduction, which helps in performing procedures painlessly. Local anesthetics work by interfering with the sodium channels on nerve membranes, thus preventing the propagation of nerve impulses. This block is reversible, allowing sensation to return once the drug is metabolized or excreted. Lidocaine, also known as lignocaine, is widely used due to its rapid onset and intermediate duration of action. It typically lasts about 1 hour. The maximum dose for plain lidocaine is 3 mg/kg, approximately 200 mg for an adult, and with adrenaline, it increases to 7 mg/kg. Lidocaine is commonly used for local infiltration, nerve blocks, and as an antiarrhythmic agent in certain cardiac conditions. However, it's not recommended for spinal anesthesia due to its shorter duration and potential side effects. Bupivacaine is known for its long duration of action, making it suitable for procedures requiring prolonged anesthesia. It has a slower onset and carries a risk of cardiovascular toxicity, so it should be used with caution. The maximum dose is 2 mg/kg for both plain and adrenaline-added solutions. In case of bupivacaine toxicity, intralipid 20% is a key treatment to counteract cardiotoxic effects. Ropivacaine is another long-acting local anesthetic with a better safety profile regarding cardiovascular toxicity compared to bupivacaine. Its maximum dose is 3 mg/kg. Ropivacaine is used in various types of anesthesia, including epidural and nerve blocks. Local anesthetics can be applied in several ways. Topical application, applied directly to mucous membranes or skin. Local infiltration, injected into the tissue to provide anesthesia in a specific area. Nerve blocks, targeting specific nerves or nerve groups to block sensation over a larger area. Intravenous regional anesthesia, IVRA, used in limb surgeries with a tourniquet to isolate the anesthetic. Spinal anesthesia, subarachnoid block injected into the spinal fluid for procedures below the waist. Epidural anesthesia/analgesia, delivered into the epidural space for pain relief during labor or surgeries. Nebulization, for anesthetizing the upper airway. Intravenous lidocaine, utilized as an antiarrhythmic agent in certain arrhythmias. To minimize the risk of toxicity. Always aspirate before injecting to prevent inadvertent intravascular administration. Avoid injecting large volumes at once, especially in highly vascular areas. Toxicity symptoms may include early symptoms, perioral tingling, tinnitus, lightheadedness. Neurological symptoms, visual disturbances, slurred speech, seizures, and altered consciousness. Cardiovascular symptoms, hypotension, cardiac arrhythmias, and potentially cardiac arrest. In managing toxicity, 1. Stop the injection, cease administration of the local anesthetic immediately. 2. Resuscitation, initiate the ABCs: airway, breathing, and circulation. Provide 100% oxygen and intubate if necessary. 3. Seizure management, administer midazolam, 3 to 5 mg, or diazepam, 5 to 10 mg. For persistent seizures, consider thiopentone or additional midazolam along with paralysis and intubation if needed. For cardiovascular support, use intravenous fluids and inotropes. For bupivacaine or ropivacaine toxicity, administer intralipid 20% with an initial bolus of 1.5 ml/kg, followed by an infusion at 0.25 ml/kg/min. The total dose should not exceed 12 ml/kg. Medscape emphasizes the importance of timely intervention and the use of intralipid 20% in severe cases, as it effectively binds to local anesthetics and mitigates their toxic effects. USML-style questions. 1. A 35-year-old patient is undergoing a minor surgical procedure and receives a local anesthetic injection of lidocaine with adrenaline. Which of the following is the most appropriate precaution regarding the use of this combination? Answer: lidocaine with adrenaline should not be used for procedures involving end artery regions, such as digital nerve blocks, due to the risk of reduced blood supply. 2. A 45-year-old patient receiving a nerve block with bupivacaine develops symptoms of hypotension, tachycardia, and altered consciousness. What is the most appropriate immediate treatment? Answer: stop the injection of bupivacaine immediately. Initiate resuscitation with 100% oxygen, and administer an intravenous bolus of intralipid 20%, followed by an infusion as needed. Monitor and manage cardiovascular instability with 4 fluids and inotropes. 3. During a dental procedure, a patient experiences seizures and perioral tingling after receiving a local anesthetic injection. What should be the first step in managing these symptoms? Answer: cease the injection of the local anesthetic immediately. Provide 100% oxygen and administer midazolam or diazepam to manage seizures. Ensure airway protection and resuscitation as needed. 4. A patient undergoing spinal anesthesia with lidocaine experiences sudden cardiovascular collapse. What should be the next step in the management? Answer: initiate the ABCs of resuscitation: airway, breathing, and circulation. Provide 100% oxygen and start intravenous fluids. If necessary, use intralipid 20% as per the protocol for local anesthetic toxicity. Recap. Local anesthetic agents are crucial in medical procedures as they provide targeted anesthesia and analgesia by reversibly blocking nerve transmission. These agents are commonly employed to numb specific areas of the body, facilitating various surgical and diagnostic procedures. However, it is important to understand their properties, uses, and the potential risks associated with their administration. Local anesthetics, while primarily designed to block sensory nerves, can also affect motor nerves, leading to possible motor weakness depending on the site of application. To enhance the efficacy and duration of local anesthetics, adrenaline is often added. Adrenaline helps to delay the absorption of the anesthetic, thus prolonging its action. The typical concentration of adrenaline added is 1:200,000. However, it is crucial to avoid using local anesthetics with adrenaline in areas supplied by end arteries, such as digital nerve blocks, or in intravenous regional anesthesia, IVRA, due to the risk of compromised blood flow. In our region, the most commonly used local anesthetics include lidocaine, lignocaine, bupivacaine, and ropivacaine. Lidocaine is valued for its rapid onset of action, making it a preferred choice in many situations. It provides effective anesthesia for approximately 1 hour. The maximum recommended dose of plain lidocaine is 3 mg/kg, roughly equivalent to 200 mg for an adult. When combined with adrenaline, the maximum dose increases to 7 mg/kg. However, lidocaine is not suitable for spinal anesthesia. Bupivacaine is known for its long-acting properties, which can be advantageous in procedures requiring extended periods of anesthesia. Despite its benefits, bupivacaine has a slower onset of action and is cardiotoxic, meaning it can adversely affect the heart. The maximum dose for bupivacaine, whether plain or combined with adrenaline, is 2 mg/kg. Due to its cardiotoxicity, bupivacaine should be used with caution. In cases of toxicity, apart from general resuscitative measures, 20% intralipid can be effective in managing cardiovascular complications. Ropivacaine is another long-acting local anesthetic with the advantage of being less cardiotoxic compared to bupivacaine. The maximum recommended dose is 3 mg/kg. Its properties make it a suitable choice in many situations where prolonged anesthesia is needed, with reduced risk to cardiovascular health. Local anesthetics have a variety of applications, including topical use, local infiltration, nerve blocks, intravenous regional anesthesia, IVRA, spinal anesthesia, epidural anesthesia, or analgesia, nebulization for anesthetizing the upper airway, and intravenous preparation of lidocaine as an antiarrhythmic agent. To prevent toxicity, it is crucial to aspirate before injecting to avoid inadvertent intravascular injection, administer small volumes at a time, and exercise caution in highly vascular areas. Signs of local anesthetic toxicity may include perioral tingling, tinnitus, lightheadedness, visual disturbances, slurred speech, altered consciousness, seizures, and potentially severe outcomes such as respiratory arrest, hypotension, cardiac arrhythmias, or cardiac arrest. In the event of toxicity, the following steps should be taken: stop the injection of the local anesthetic, start resuscitation by addressing airway, breathing, and circulation, and administer 100% oxygen. Intubation may be necessary if the patient cannot maintain adequate ventilation. For seizures, administer midazolam, 3 to 5 mg, or diazepam, 5 to 10 mg. If seizures persist, additional medications such as thiopentone, 1-2 mg/kg, or further doses of midazolam may be required, along with paralytics if needed. Treat cardiovascular instability with 4 fluids, inotropes, and, if bupivacaine or ropivacaine was used, administer 20% intralipid. In cases where bupivacaine or ropivacaine toxicity is suspected, the treatment protocol involves administering an initial bolus of 1.5 ml/kg of 20% intralipid intravenously, followed by an infusion of 20% intralipid at 0.25 ml/kg/min. If adequate circulation is not restored, repeat the initial bolus twice at 5-minute intervals. The total dose of 20% intralipid should not exceed 12 ml/kg. Understanding the use, risks, and management of local anesthetic agents is vital for ensuring their effective and safe application in medical procedures. Thank you for joining this tutorial on local anesthetic agents. I hope this overview helps you understand their use, potential complications, and management strategies. If you have any questions, feel free to leave a comment. Don't forget to like, subscribe, and hit the notification bell for more educational content. See you next time.